Hi, I am presenting a simple case of vaginoscopic method of doing a hysteroscopy using a conventional 4 millimeter telescope with a diagnostic sheath showing a outer diameter of 5 millimeter. The routine conventional hysteroscope which can be very easily performed even without holding the cervix with the valsalum or putting the speculum into the cervical canal, which has the advantage of very minimal injury to the cervical canal and even into the uterine cavity. So the pathology that is there in the uterine cavity, like maybe polyps or maybe some adhesions, or even sometimes it can be septa may be present, which may be obscured if we are dilating the cervical canal and then doing a diagnostic hysteroscopy. Though it may not be very difficult to take out all the blood clots, but it takes little extra time where vaginoscopically entering into the uterine cavity, which has the additional advantage of very good view all throughout. Though it will not take extra time, maybe 1 minute extra time that may be necessary to dilate the cervical canal. Here we can see we just entered the vagina and holding the labia to prevent the efflux of the saline and just waiting in the cervical canal for 1 or 1.5 minutes for the uterine cavity to distend and then dilate the cervical canal and then try to slowly negotiate this telescope into the uterine cavity, keeping the opening of the cervical canal at 6 o'clock position and slowly doing a little seesaw movements or torque like movements, which will further helpful in negotiating the hysteroscope into the uterine cavity, which will lead to very easy entering into the uterine cavity, which gives a good view of uterine cavity. So that is a some seesaw movements and torque like rotating movements we are doing very gently and just wait for the cervical canal to dilate. Many a time this has become successful and then we enter into the uterine cavity. So small bubbles that are going into the uterine cavity, again it shows that there may be patent fallopian tubes we can anticipate. So now we are in the uterine cavity. We can see the tubal ostia on the left side and we are seeing the anterior uterine wall, that is the fundus of the uterine wall, and the right uterine wall, almost normal uterine cavity. So this is a small video just to demonstrate that diagnostic hysteroscopy with a conventional telescope of 4 millimeter and a diagnostic sheath which is 5 millimeter can be very well performed using a vaginoscopic method without putting a speculum into the vagina or holding the cervix. Thanks for watching this video. Please put it any comments in the comment box. I'll try to answer them.